Chronic stress is a prolonged, often overwhelming feelings of stress that can negatively impact a person's daily life. Short-lived feelings of stress are a regular part of daily life. When these feelings become chronic or long-lasting, they can severely impact a person's health. Stress is a biological response to demanding situations. It causes the body to release hormones such as cortisol and adrenaline. Hormones help prepare the body to take action, for example, by increasing the heart and breath rate. When this occurs, a doctor might describe a person as being in a state of heightened alertness or arousal. Many factors can trigger a stress response, including dangerous situation and psychological pressure such as work deadline, exams, and sporting events. The physical effects of stress usually do not last long, or some people find themselves in a nearly constant state of heightened alertness. This is chronic stress. Some potential causes of chronic stress include high-pressure jobs, financial difficulties, challenging relationships. Chronic stress puts pressure on the body for an extended period. This can cause a range of symptoms and increase the risk of developing certain illnesses. The type and severity of symptoms vary considerably from person to person. Signs and symptoms of chronic stress can include irritability, which can be extreme, fatigue, headaches, difficulty concentrating, or an inability to do so, rapid disorganized thoughts, difficulty sleeping, digestive problems, change in appetite, feeling helpless, a perceived loss of control, low self-esteem, loss of sexual desire, nervousness, frequent infections or illnesses. A variety of life experiences can cause stress, and these may begin in childhood. When children experience traumatic events, it can lead to the development of chronic stress. They may last into adulthood. These type of events are known as adverse childhood experiences. In research by the Centers for Disease Control and Prevention, 61% of adults surveyed across 25 states said they had experienced at least one type of adverse childhood experience, and nearly 1 in 6 had experienced 4 or more types. Examples of adverse childhood experiences include mental illness in one or more parents, emotional, physical, or sexual abuse, substance misuse in the family, parental divorce, homelessness, incarceration of parents or close family members. In adulthood, chronic stress can happen as a result of very similar causes, as well as problems in the workplace, unemployment or financial problems, injury that impact a person's daily life, concern about problems in the country or the world. According to the Stress in America 2020 survey by the American Psychological Association, 65% of people surveyed said the current uncertainty in the nation is stressful, and 60% are overwhelmed by the issue the country is facing. In addition, 70% of parents reported family responsibilities as a source of stress, and 63% are stressed by the impact of COVID-19 on the 2019-20 school year. If strategies such as those listed above are not helping, it is important to see a healthcare professional for advice and support. A doctor may recommend psychological therapy such as cognitive behavioral therapy. One established aim of CBT is to help people deal with chronic stress in structured sessions. A therapist works to enable a person to modify their behavior, thoughts, and feelings concerning stressors. CBT can help a person develop tools and coping mechanisms to manage stress responses. Sometimes a doctor recommends medication to help treat some symptoms of chronic stress. For example, they may prescribe antidepressant to treat anxiety or depression. For people with trouble sleeping, doctors may prescribe sedatives. Research has shown that chronic stress can impact the brain and the immune system. The brain's neural network, especially in the prefrontal cortex, can actually reduce in size. Doctors have seen this in imaging of people's brain. When this happens, it may lead to cognitive, emotional, and behavioral dysfunctions. When a person experiences stress, this stimulates their immune system to react over time. When stress is chronic, the immune system can become overstimulated. This may lead to the development of diseases and health problems. Over a long period, chronic stress can contribute to the development of a range of physical and mental disorders, including heart disease, high blood pressure, diabetes, obesity, a weakened immune system, sexual dysfunction, gastrointestinal disorder, skin irritation, respiratory infection, autoimmune disease, insomnia, burnout, depression, anxiety disorder, post-traumatic stress disorder, schizophrenia. Generally, acute stress is stress that a person experiences. Short-term acute stress typically manifests immediately after a person experiences a stressor as a fight or flight reaction. Stress can also be episodic, when means a person experiences it over a long time but inconsistently. They experience stressful periods and periods with less or no stress. In comparison, chronic stress is stress that a person experiences continuously throughout their life to the point where feeling stressed becomes a normal state of being. Chronic stress can seem overwhelming and a person may feel unable to regain control over their life. However, a number of strategies can help to reduce stress levels and improve well-being. Some methods for managing stress include understanding the signs and symptoms. These indicators vary, but if a person can recognize their own signals of stress, they will be better able to manage them. Speaking to friends and family, they can provide emotional support and the motivation to take action. Identifying triggers. It is not always possible to avoid triggers of stress. However, taking note of specific triggers can help a person to develop coping and management strategies, which may involve reducing exposure. Exercising regularly. Physical activities increases the body's production of endorphins, which are chemicals that boost the mood and reduce stress. Exercise can involve walking, cycling, running, workout, or playing sports. Trying mindfulness. People who practice this form of meditation use breathing and throw techniques to create an awareness of their body and surroundings. Research suggests that mindfulness can have a positive impact on stress, anxiety, and depression. Improving sleep quality. Getting too little sleep or sleep of poor quality can contribute to stress. Try to get at least 7 hours every night and set regular time for going to sleep and waking up. Avoid caffeine, eating, and intense physical activity in the hour before bed. Do not try to deal with chronic stress alone. If self-help strategies are not working, a doctor can provide support and advice about treatment options. They can also refer a person to a more specialized healthcare provider, such as a psychologist and psychiatrist. Anyone feeling overwhelmed by stress should see a doctor as soon as possible, especially if they are having suicidal thoughts or using drugs or alcohol to cope.